So the EVOX software runs 5 procedures. It runs an electroencephalogram. It runs 4 evoked potentials. So the EVOX software runs 5 procedures. It runs neuropsychological testing. It runs an electroencephalogram. It runs 4 evoked potentials to look at brain processing speed. And it runs an electrocardiogram, which allows us to look at the autonomic nervous system.
What are the patients that are right for an EVOX assessment and biofeedback training?
So any patient that's suffering from disorders associated with neurologic dysfunction are candidates for the EVOKE system. Affect and mood disorders, mild cognitive impairment, brain injury, chronic pain. All of these types of patients are inattention and ADD. All of these types of patients have neurologic-based symptoms and patterns that are able to be looked at and measured using the EVOX system and the procedures.
How does an EVOX assessment and the biofeedback training help a patient that a doctor can't already do by himself in the practice?
So the EVOX system provides a report with numerics and quantified data that the doctor can then derive neurofeedback and heart rate variability biofeedback programs for. This retraining of the nervous system, both the brain and the autonomic system, improves cognitive function, improves sympathetic, parasympathetic balance in the nervous system. And it's a natural way that the person can retrain the system without the use of medications.
Right. They say the EVOX assessment is similar to a lab test for the brain. What are some of the biomarkers that are gathered that help a doctor make a patient management decision?
Sure. So the EVOX procedures can actually be looked at as a brain panel of sorts. So it runs the electroencephalogram and the evoked potentials. We look at brain processing speed. We look at peak frequency, which is a measure of cognitive capacity. We look at fast brain waves versus slower brain waves to look at neurologic function, attention, and processing capabilities. And we run the electrocardiogram to look at heart rate variability, which gives us information about autonomic nervous system balance and function.
Good. I see the EVOX system all comes in one contained suitcase, if you will. Tell me about how this system is used in a practice. How easy is it to use?
So the EVOX system is very easily incorporated into a clinical practice. The system is portable. It simply uses a laptop and a small Bluetooth wireless amplifier. Uses a standard electroencephalogram cap, and that records the neurologic data. So the system is portable. It's easy to use. All that's required is a desk and a chair. And the test is run with only 20 minutes of data acquisition and about a 10-minute patient setup.
Good. I think that's good for right now.
Okay, so we got patient. We can do more after. So we got patient types. I can try to do some more natural stuff.